Hello! Today we're going to go through a comparison of traditional versus integrated medicine courses. My name's Cami and I'm a second year medical student at the University of Birmingham. So choosing the right medical course is so important when applying for medicine. You need to think about how you learn best so you can choose the best teaching style and therefore the best medical school for you. So make sure you stick around till the end where I'll be giving you a top tip on why understanding how you learn best is important for your interviews. So we've put together the Medic Mind University Comparison Guide, which is linked below if you want more information. So this will help you make a more informed decision on where to apply. So as with any style of course, there are advantages and disadvantages of each. So we're going to be going through these two for the traditional and the integrated courses, and also what kind of teaching you should expect. So before we get going, let me know in the comments whether you've looked into the traditional and integrated courses yet, and if you think you know which one you'd prefer. So, starting with the traditional courses, there are currently only 3 of these in the UK, and that's Cambridge, Oxford and Edge Hill University. So the key thing about traditional courses is that they split up the preclinical and the clinical aspect of the degree. So you'll usually have about 3 of each. So you'll usually have 3 years of pre-clin and then 3 years of clinical afterwards. So during the preclinical phase, students will usually learn the biochemistry, physiology and a bit of anatomy before looking at any of the clinical side. So often there'll be a lot of lab work, a lot of research and also some essays as well, particularly in Oxbridge. And the teaching style will be mainly lectures and some seminars. So during the clinical years, the next 3 years, students will be able to have more patient contact and they'll be going on their clinical placements, and there will still be teaching, but it'll be much more clinical teaching. So usually this will be in hospital and it'll be discussions in groups about patients you've seen. So the benefits of a traditional course are that you have a great scientific basis before going into your clinical years. So when you do get to placement, you'll have a much better understanding of the science behind everything you see, and everything should make more sense and you should get a good learning experience from your clinical years. However, you do have to wait till the 3rd or 4th year to have any patient contact at all, which some students don't like. And it can be difficult for some students to basically only do the science for the first 2 or 3 years. It can be a bit like doing a biomedical degree, which can be difficult for some students as obviously they applied to medicine, which technically itself is a clinical course. Furthermore, some students might find it difficult to learn when they're not applying their knowledge to practical clinical situations. So make sure you are able to learn just from the lectures and the seminars for the first 3 years of your course if you're thinking about applying to a traditional course. So the next is integrated courses. So the key thing here is that the preclinical section and the clinical section overlap. So the majority of unis in the UK have this kind of teaching style. So they often use a spiral curriculum. If you're not aware of what this is, don't worry, I'll go into more detail about it later on in the video. And of course, all medical schools are different. Some unis will only introduce the clinical side very sparingly from the beginning, whereas other universities will have you in hospital from day one. So it really depends from uni to uni. A good way to compare this is to look at the number of days on placement per year. So usually this information will be on the uni's website and it should be quite easy to find. If not, just get in touch with them, obviously. So often with integrated courses, they use a system-based approach. So for a particular system, you'll learn the physiology, biochemistry and anatomy along with the clinical correlations just for that system. So say you were learning about COPD, you might have some lectures to start with on the physiology and the biochemistry, and then you might have an anatomy sessions on the lungs, and then you might go into your GP placement where you'll sit in with a GP for consultation for respiratory patients. So teaching may also involve PBL, which I will go into more detail into later on. So many universities using an integrated approach will use a spiral curriculum, as I've already mentioned. So this is basically when you revisit the same topics or the same systems throughout your time at medical school, and you're going to be building on the content every year, so you're learning more and more. So the benefits of an integrated course are that you get early patient contact and you're able to apply the scientific knowledge that you've learned to real life cases as you go, which does make learning easier for quite a lot of students. So you'll also be learning clinical skills from early on. So you might be taking blood pressure, or you might be doing chest examinations, whatever it is, you'll be learning from earlier on rather than having it all at the end. However, this learning style does mean that sometimes on placement, you'll be going in without enough scientific knowledge. So you might be thrown in the deep end as such here, and you might not get the full learning experience as you would if you knew all of the science. So PBL is when students are split into groups, often facilitated by a member of staff, and they're given a problem that they have to solve between them. So this requires a lot of self-motivation, and although it does develop those problem-solving skills that are really, really useful in hospital, it doesn't have that standardised approach, so it can result in some students having gaps in their knowledge. So it really is down to personal preference. You have to understand how you learn best so you can pick a course where you will get the most out of your time at medical school. So a final top tip, at interview you might be asked why that course, why that teaching style, so you need to be able to talk about your learning style and how that suits the course that you've chosen. If you'd like any help with choosing a medical school or with your medicine application, then make sure to get in touch with the Medic Mind team. So thanks for watching. I hope you found this series on choosing your medical schools useful. Best of luck with your application, and I'll see you next time.